Okay.
Okay, so AJ, I know that originally you came to me being referred by your dentist.
Okay.
And tell me, what did you think you were being referred for? Did you have any idea what was going on? Or?
Uh, I knew I needed work done on my gums,
Mm-hmm.
and for now, it's just not really any more than that. I mean, I wasn't sure how much of a procedure, how little of a procedure had to be done.
But you were aware that you had uh, the type of extensive disease that we talked about, or you didn't know about that? Or
Yeah, yeah,
you were aware of
yeah.
that. How did you feel about, um, at that point and even now, the function of your mouth? Is it difficult to eat, or is it not difficult to eat, or?
Uh, at this point on the tops, I think it's kind of like almost a mild pain. I was using for a while. I was using like Orajel and taking Tylenol. I think I've just gotten kind of used to it now.
Yeah. You still take the Orajel?
But I was thinking lately that I think I'll probably notice a difference in a big difference just in eating and everything once
Oh,
we do
you?
what we're gonna do.
Oh, for sure. Do you still use the Orajel?
No,
No.
no, I quit the Orajel and Tylenol. Like I said, I just kind of got used to it.
Right. Now, you mentioned before that you do surfing, right?
Right, right.
Okay. You do that a lot, or?
Uh, it depends. I could do it 4 or 5 days in a row, or I might not do it for 2 weeks, depending on just when it's late.
Have you had any issues with surfing and getting hit in the face with your teeth or anything like
No.
that? No. Okay. Were your teeth on the upper front always crowded, or have they gotten worse over the years?
Well, when I was a kid, I needed braces, but my mother couldn't afford them at that time, and I think what the dentist did was he was either going to pull a couple teeth. I don't remember if he ever did or not. Actually, to
Right.
give him a little more room or something.
Right.
So yeah, probably.
Um, I see that you've had some work in the upper front area by your previous dentist.
Correct.
Um, are you unhappy, or are you happy with your upper front appearance? Does it bother you at all?
Uh, no. I mean, it was better than it made it look better.
Since you had the dental work done.
The two front ones he made a little longer than the old ones. Took a while to get used to that, but
Yeah.
then I figured, well, I guess he's getting it more proportional or
Yeah,
something.
that's true. Yeah, that's
I didn't
true.
know if that was his. What do you say? His something he liked, his preference, or what?
Well, maybe his view, but it should be, yeah. Um, you, do you know anything about the concern about periodontal disease at the level that you have and its effect on your body, and potentially on your heart, any of that at all? Have you heard about that?
I've heard of that, and it was. I guess the way I looked at it was like, drinking coffee, is it good for you? Is it bad for you? Is it?
Controversial, yeah.
I wasn't sure it was 100% that they decided that was the way it was. Or,
That's a good point, because it's not 100% definitive. There are some studies that show that it can have a correlation, but I don't think that the jury's out yet where it's 100% you have a certain level of disease that you can have a problem with your heart. So you're right. It's like, coffee could be good, coffee could be bad. We've talked a lot. We met 3 or 4 times, and I think you have a wonderful understanding at this point. Is that correct, of what we're going to do?
yeah,
Okay.
yeah.
What are you looking forward to the most, other than being done, of course? Uh, what are you looking forward to the most, as far as the end result goes?
Uh, I guess just the overall appearance, comfort, the whole thing.
Mm-hmm.
I mean, I know something's got to be done, so if I had my druthers, we wouldn't have ever been having this conversation.
Well,
I
that's
was
true.
I was a crest kid. Had like 2 cavities in my whole life,
Mm-hmm.
if that, whatever.
Were you getting in your?
Now you're losing all your
Well, not all. We got some on the bottom. In your previous dentist office, did you have cleanings every now and then, or very regularly, or?
There was times when I would go like 3 times a year, sometimes a couple times a year, because I wasn't sure if the extra one was really doing anything.
Right. But you never really went kind of a year or so without any cleanings at all?
Not in the last 15 years, 15 or 18 years.
So would it be correct for me to make a statement that over the last 15 years you were having cleanings about every
At least twice.
year, twice a year, maybe 3 times a year, ever 4 times a year? Would you come in every 3 months? Was that ever?
I don't think I was doing every 3 months. It was probably
For every 4 months.
I know there was times when, like I say, when I would do it 3 times a year, and then I'd say, this is
And was it the same hygienist always, or was it a different hygienist?
same hygienist. I mean, one time I had a deep cleaning at a place in Avonshire. I forget what it was at that time.
Right.
And
Separate from your other dentist?
right before I started going to Alpert.
Mm-hmm.
Then when I first went there, they did a deep cleaning there.
Mm-hmm.
And then just before I came to see you, actually, Margaret did another, what she called deep cleaning.
Margaret was your hygienist?
Yeah.
Mm-hmm.
Which I didn't really consider like a deep cleaning like the other ones that I had, but they really
Semi-deep.
deep cleaning.
So she was the one who was doing your cleanings then throughout all these years?
Yeah.
Okay. So now we discussed different treatments, as you know, and the one that we ended up with, you're perfectly comfortable with.
Yeah.
Okay, good.
Yeah.
Good. Well, I have to say that so far I think you've been a real gentleman and a scholar, and you've really had, I think, a very appropriate amount of inquisitiveness as to what we're going to do, and I feel very comfortable that you know what you're getting into, and it's a big step for you, obviously for anybody, but I feel very comfortable that we discussed it a lot, and we've talked with your dentist, and everybody's on the same page, and you would agree with that at this point. Is that right?
Yeah.
That's important, including your wife, right?
Yeah.
Yeah. Because I know she's been here a few times also, so she has a full understanding also of what's going to be done, right?
Oh yeah. She's had more dental work done during her life, so
Yeah, she has a little bit more dental knowledge, obviously, because she's had a lot of dentistry done. Any questions you have at all?
nothing I can think of. Like I say, I've gotten okay with it. Kind of accepted the whole.
Yeah, that's the feeling that I get very much from you at this point. And that's great. All right, great. Thanks so much, Karen.